Welcome. My name's Dr. Paul Lindsley. I'm Associate Professor for Mental Health Nursing. I'm part of the Mental Health Nursing lecturing team. And I'm going to take you through a few slides. It shouldn't take too long. And I'm just going to tell you a little bit about what you can expect and what mental health nursing is. This is a slide that, or the picture on the slide was used as part of a national campaign a few years ago. And it was part of the Royal College of Nursing, who was trying to promote mental health nursing at the time when we were discussing the future of mental health nursing. And it was a big national campaign. And I did various things, but this was one of the quotes that was used by the campaign. And I reflected on this. I have always found mental health nursing to be humbling experience. I have met some incredible people that have truly been inspirational in what they have said and done. Mental health nursing has literally taken me around the world. I've witnessed events that have challenged and experiences that have made me change my beliefs and never stop learning. I am proud to be a mental health nurse, and I continue to be and take pride in being a mental health nurse. I've been a mental health nurse for over 30 years now, and I can hand on heart say I've enjoyed every minute of that experience. I've met some incredible people along the way, people that have impacted not only on my practice, but also on my view of the world, and I continue to take heart in the humanity of the world, and really enjoyed myself. I actually started out as a adult nurse working in acute medicine before converting to mental health, and I've never looked back. I've just, everything that I've obtained in the way of qualifications and education has all been through nursing. It's just been a great time. So this slide is just a collage of pictures showing some of the areas that mental health nurses work in. There are nearly 290,000 nurses registered with the Nursing and Midwifery Council, the NMC, which is our governing body in England, and 12%, about 34,000 of those, are registered mental health nurses. So we're not a particularly big field, and we're a specialist field. And as part of that, it seems like there's a community of mental health nurses. I can go up and down the country and bump into people that I've worked with, or I've mentored, or educated, or looked after, and it's just like being back with the family. So the attraction for many who work as a mental health nurse is that no 2 days are ever the same. Mental health nurses work in a vast array of inpatient and community settings, medical centres, schools, prisons, undertaking research, or, as I'm doing currently, work in universities. Mental health nurses work with individuals across the lifespan, from specialist perinatal services, child and adolescent services, working age individuals, older adults, and later life dementia care. It really covers the whole lifespan of a person's journey. Some days will be structured with arranged appointments. Others will be responding to emergencies and thinking on your feet. And this is one of the skills of a nurse, that incredible flexibility, that ability to work under pressure and to meet various demands of various people. Across the UK, there is a range of mental health services offered in the community, divided into primary, secondary, and specialist services. And whilst they might vary with geographical locations, the core skills of a mental health nurse remain the same. So what this training prepares you to do is work within any locality across the UK and further afield. The registered mental health nurse qualification is recognised around the world. Within primary care, mental health nurses will receive referrals from GPs and A&E departments, and following assessments, nurses will offer short-term interventions which may include anxiety management, support with depressed mood, advise on possible medications, and work with a range of common mental illnesses. As a nurse, you will spend one-to-one time with individuals for a set short period of time for 10 to 12 weeks, for example, which is fairly typical within the community. If a person requires longer term support, you may refer them to the secondary mental health services. Mental health nurses working in secondary community services will work with people who have more complex or serious chronic mental health conditions. They may have been in hospital or may be diagnosed with an illness such as schizophrenia, mood disorders such as serious depression or bipolar affective disorder, or post-traumatic stress disorder for that matter. Many areas of the UK have specialist community teams, including memory clinics for those with dementia. And funny enough, my brother, who is also a mental health nurse, works as part of the memory services within his locality. They have assertive outreach services for difficult to engage with patients, early intervention in psychosis services, crisis teams, mental health for the homeless, community forensic teams. Forensic means that the person is suffering from a mental illness and at the same time has committed a criminal act, and that is very much my background. Police street triage and many, many more. And we're seeing mental health nurses where in the past you wouldn't have expected to see a mental health nurse. So working in unemployment offices, getting people who've had a mental health problem or are living with a long-term mental illness back into employment. It really is changing the way that we think about mental health nursing. The National Strategy for Mental Health, the 5-year forward view, published in 2016, places emphasis on preventative and early intervention for mental health issues. And as part of this, we're concerned with not just helping people recover from mental illness, but we're about staying mentally well and about preventing, if we can, people to develop mental health, poor mental health. So there is a real focus at the minute on public mental health. Now, with a reduction in hospital beds, so we've had a shutting down of the asylums in the 90s, and then hospitalisation, and then onto community care. We've seen inpatient mental health units now admit people who are in acute stages of serious mental illness, with a high percentage being detained legally under the Mental Health Act. As a mental health nurse working in an inpatient unit, you will work as part of a ward team to deliver care and treatment to those in crisis. Inpatient settings often mirror services within the community, with child and adolescent units, working age acute mental health wards, specialist dementia wards, and psychiatric intensive care units. There are also national units and regional units for psychosis, eating disorders, mood disorders, and therapeutic communities for those with personality disorders and emotional difficulties. There are longer-term inpatient settings for patients involved in the criminal justice system, forensic mental health, and rehabilitation units where people can stay for up to 2 years. You will work closely with psychiatrists and other professionals to establish pathways for individuals and maintain a therapeutic environment on the ward through group work, one-to-one time and facilitating time off the ward. Historically, mental health nurses would always begin their careers working in hospitals. The skills you develop working in acute wards are transferable to all settings and help nurses build confidence and knowledge. As you move through your training and career, it's likely that you will develop a particular interest in a field of mental health. And part of our job as lecturers is to try and support you in your decision making and support you in your career planning, and to facilitate where we can experiences that lend themselves to your interests. What will you look at as part of your training? You will look at many things, but a lot of the work will be centered around looking at the 7, if you like, big disorders. So when we think of the 7, we have mood disorders, and these include disorders that affect how the person feels, such as a persistent sadness or feelings of elation. Mood disorders include clinical depression and bipolar disorder that you may have heard of. Anxiety disorders anxiety is an emotional characterized by an anticipation of future danger or an extreme feeling of being ill at ease. Examples include panic disorder, obsessive compulsive disorder, specific phobias, and generalized anxiety disorder. Psychotic disorders, these include disorders that impair a person's sense of reality. The most notable being, example being a psychotic disorder such as schizophrenia. Cognitive disorders, these are those disorders that affect a person's ability to think and reason. They include delirium, dementia, and memory problems. Developmental disorders cover a range of problems that usually first begin to make themselves known in early childhood or adolescence. Personality disorders are an enduring pattern of behaviour that is dysfunctional and leads to distress or impairment, such as antisocial personality disorder. And then we've got dissociative disorders. This is a type of disorder in which the person's sense of self is disrupted, such as when there are physical symptoms in the absence of a clear physical cause, such as hypochondria. You will learn how to respond and work with people who have these disorders, and that in turn includes a range of skills. Whew, that's a lot to get through. Anyway, meet the team. We're a small team, but we cover all bases. So if we start in the top left-hand corner, we have Caroline, and then beside Caroline we've got Jane, Ros, Sherry, and at the bottom, I was going to say the chap with the bald head and beards, but they're very similar. We've got Ian and Jason. And what's really fantastic is that all of us write for publication. We promote evidence-based practice. We'll research as well as having connections with clinical practice. A lot of us are dual qualified. We are therapists as well as mental health nurses, and we're active in our fields of interest. So, as I say, we've got Caroline, whose interest is rehabilitation, down to Jason at the bottom, whose interests are in older people services. Ian is therapeutics. Jane, like myself, is forensic and acute care, as is Sherry, who's very active in research around schizophrenia, and Ros, who is your course director, and has an interest in child and adolescent learning disabilities as well as mental health. So I think we cover a wide spectrum. Main thing is we like you to have fun while you learn, and we value and we see you as partners in that learning. And because we're not a big group of people, then we try to make it as interactive as possible. But here's a slide of myself taking a class. These are actually international students that we link in with, and I'll tell more of that in a bit. And this is us looking at mental health within youth and adolescent populations. And if you can see at the slide at the back, we're asking them to think about what advice would you give your younger self when thinking about your mental health. So we're trying to make these classes as interactive because you all will come with life experience, and you will all be able to make a contribution. But the most important people are the students themselves, and these are students from last year who graduated in September and are now working out both locally within Norwich and further afield. This is the 6 of them. They were going off. The photograph is them going off, setting off from Norwich to Edinburgh to take part and to represent the university at a student workshop looking at the future of mental health nursing. Apparently they were very good and represented the university, and they were a credit to work with, and I'm sure each one of them will make fantastic mental health nurses. And when we talk about students as partners, here you'll recognise 3 of the team, myself, Ian and Sherry, but the 2 at the end, the important people, are the students. Now, this is an international conference, and we encourage this. We encourage students to work with us and to present papers and what have you. But these 2 students, Catherine on the left, and as you look at it, and Lou on the right, this was an international research conference, and both students presented their own work that they'd done as undergraduates. So this is as they were doing the course, they generated this research, which they then presented at an international conference, and they absolutely nailed it. Catherine, as you'll see, was talking about how women verbalise their experiences of domestic abuse, and Lou looked at a strategy for reducing self-harming behaviours within adolescent populations. Lou has since had her work taken up by a number of trusts, and her scheme is used as part of active treatment interventions. They're now both qualified. And just a little bit more on Catherine. If you want to look at this link, Catherine, as you can see, is now qualified, and she has since took a lead within her trust, looking at women's issues of domestic abuse. And she herself has been a victim of domestic abuse, and is starting to bring people together to look at that and to develop strategies and to promote the safety of women undergoing this and men of this terrible situation. This is a press release from the local trust, which you can access and read. We're proud of all our students, and I can give you many examples of how our students have really made a difference. This slide, starting at the top left and working clockwise round, the first picture is the square in Osijek in Croatia. The next picture is Cairns in Australia. The next picture after that is in Freetown in Sierra Leone. And then if we go to the bottom, starting at the left again, if we go to the bottom, with the Buddhai figures. That is Colombo, Sri Lanka. The next picture is Toronto, Canada, and the last picture is Lublin in Poland. And the reason why I've put these up is we've had mental health students go to all of these places and experienced mental health in these different countries. And we facilitate that, or we can facilitate that as part of the training. There is a cost involved, but we can facilitate that. And the requirement is wherever our students go, they come back and feed back to their peers, and they often learn new ideas or look at things in a slightly different way, having had these experiences. And they'll often say it is life-changing. And again, we remain with links across all these places and even wider. We've linked in with many countries. And really that idea of nursing being a world family really hits home. And then just to say that what are we looking for in a student? Well, working in mental health requires a level of emotional resilience and self-awareness. As nurses, we walk alongside individuals in their darkest and scariest times. Often people's behaviour can be difficult to understand or explain and can cause distress. Mental health nurses try and help individuals find meaning and understanding of their experiences and build coping mechanisms to prevent further relapses. You will need compassion and empathy, qualities which you may have developed from your own experiences in life. Human beings are fragile, and as a mental health nurse and student, there will be a recognition that anyone at any time can be susceptible to vulnerability and mental illness. Listening is a skill. We can all sit down and have a conversation, but to actively listen to another person requires patience, a non-judgmental attitude, and an ability to put our own minds and thoughts out of the way. As a mental health nurse, you will receive ongoing supervision in order to support you developing these skills and help you make sense of your own mind and lives so that you can support others. Final quote, and I love this quote. This came from a nurse. Sometimes I am inspired. Sometimes I inspire my patients, but most often they inspired me. Thank you ever so much.